Hello and welcome to Lifelens TV. I'm Jennifer Harrison, and today we're diving deep into one of the most controversial deals in recent times, how a single tender for Kenya's universal healthcare plan morphed into a multi-billion shilling saga that has left Kenyans questioning not just the numbers, but also the players behind the scenes. So get comfortable because we're about to break down how things started smoothly and how they got complicated thanks to some very powerful hands behind the curtain. Let's get into it. It all began on January 24, 2024, at around 3:30 p.m. Safaricom, Kenya's telecom giant, had its eyes set on a very lucrative tender. This was for an integrated system that was part of the government's Universal Healthcare Coverage (UHC) plan. The goal? To digitize the health sector and bring services closer to Kenyans in a seamless, tech-driven way. Safaricom's Public Sector Digital Transformation Director, Boniface Mungania, led a team of 7 into an Afia House boardroom that afternoon. They opened the meeting with a prayer, setting the tone for what seemed like a straightforward negotiation. On the other side of the table, representing the Ministry of Health, were officials like Liti Wambua, Anthony Lenaiyara, and several others. Along with them was Cliff Otiga, a member of President William Ruto's Council of Economic Advisers, and independent contractor Daniel Mwai. Now at this point, Safaricom had already submitted its technical and financial proposal. And guess what? It wasn't as pricey as you might expect for such a huge national project. The total cost, a solid 48.3 billion Kenya shillings, to be implemented over 10 years. But here's where things started to get interesting. The Ministry of Health and Safaricom went through negotiations, and guess what? Safaricom actually agreed to give some pretty significant discounts. They reduced the cost of providing a drug utilization review system from 2.7 billion Kenya shillings to just 312 million Kenya shillings. They also slashed the price of their primary healthcare and hospital management systems from 9 billion Kenya shillings to 3.4 billion Kenya shillings. It seemed like a win-win situation, right? Safaricom was on board, the ministry was happy, and the taxpayer stood to save some serious cash. But then, something strange happened. After all the handshakes and agreements, Safaricom went back to the drawing board. And when they came back, the price tag had skyrocketed. We're talking a jump from 48.3 billion Kenya shillings to a jaw-dropping 104.8 billion Kenya shillings. Now you might be wondering, what on earth caused the price to shoot up by 56.5 billion Kenya shillings? Well, this is where things get murky, and a new player enters the game. Enter Apeiro Ltd, a subsidiary of a UAE-based company with links to the Adani Group. Yes, the same Adani Group that's been making headlines for winning high-stakes contracts in Kenya, including the massive 95.68 billion Kenya shillings deal to build electricity transmission lines. So what changed? When Safaricom teamed up with Apeiro Ltd and Convergen's Network Solutions Company, the whole project got, let's say, upgraded. The health cloud data centers that Safaricom initially tagged at 780 million Kenya shillings suddenly shot up to 5.097 billion Kenya shillings. Yes, you heard that right. Nearly 7 times the original cost. Security and support solutions, once capped at 945 million Kenya shillings, were now priced at 5.2 billion Kenya shillings. Even the drug utilization system, which Safaricom had agreed to lower to 312 million Kenya shillings, was now back at 2.4 billion Kenya shillings. It's like they took the original proposal, added a couple of zeros to the end, and called it a day. And who's left holding the bag? You, me, the Kenyan taxpayer. But here's where things get even more interesting. Apeiro Ltd, the biggest player in this consortium, holds 59.55% of the stake. Safaricom, the one we all know, only has 22.56%. And the rest goes to Convergens. But guess who Apeiro is linked to? None other than the Adani Group, the Indian conglomerate that has a knack for landing these controversial high-stakes contracts all around the world. Now let's take a step back for a moment. What Safaricom, Apeiro and Convergens are proposing isn't just a simple service agreement. They're suggesting that the Ministry of Health pays them by levying a service charge on all transactions related to the UHC plan. That means if you're a member of the Social Health Insurance Fund, SHIEF, every time you or your hospital submits a claim, you're paying extra to finance this 104.8 billion Kenya shillings project. And this is where it really starts to hurt. The consortium's projections show that a 5% service fee, their best-case scenario, could raise an extra 141.4 billion Kenya shillings over 10 years. Even in their most likely scenario, they expect to raise 111 billion Kenya shillings, and in the worst case, they still expect to pull in 63.2 billion Kenya shillings. So whether it's 1.2, 5% or 5%, Kenyans will be paying the price for this ballooning deal. And here's the kicker. This whole thing was agreed upon just hours after Safaricom and its partners submitted their new proposal. Within minutes of the January 24th meeting where they prayed and negotiated, Medical Services PS Harry Kimtai sent a letter indicating the ministry's intention to award the contract to Safaricom. And when the consortium proposal came in, it was almost identical to what Safaricom had originally bid for. Except, of course, for those insane price hikes. So what's the explanation for these price hikes? Dr. Harry Kimtai, the Medical Services PS, says it's because they expanded the scope of the project. He says they needed to bring in more government agencies, like the Pharmacy and Poisons Board, and install a track and trace system to monitor the production and quality of drugs. But here's the thing, those registries, those systems, were already part of the original proposal. So what does all of this mean for Kenyans? Well, the tender has been awarded, and Safaricom is going to start collecting payments as early as February 2024. They're promising to deliver an integrated healthcare technology system that will digitize hospitals, track drugs, and improve healthcare. But the price? It's no longer just 48.3 billion Kenya shillings. It's 104.8 billion Kenya shillings, and that extra cost is going to be passed on to you and me. This is more than just a healthcare system. It's about transparency, accountability, and the burden that ordinary Kenyans are being asked to bear. Deals like these have the power to change lives, for better or for worse. The question is, will we see the benefits, or will we be left footing the bill for years to come? Thank you for joining me here on Lifelens TV. Be sure to subscribe for more in-depth breakdowns of the stories that matter. Stay informed, stay vigilant, and as always, be part of the conversation.